Here are 5 things that I wouldn't do as an OBGYN. Number 1, I personally would not choose to birth outside of a hospital. In the United States, birthing outside of a hospital or a birth center has increased risks for the baby, and so I chose not to take those risks on. I also felt very comfortable birthing in a hospital. And I know that my views of pregnancy and labor and delivery are a little different than the general population because I have seen everything that can happen in pregnancy and childbirth as an OBGYN. But I also know that although those risks are low, they can happen. And so for me, I chose safest giving birth in a hospital. Number 2, I would not let my pap smear expire. Now, do I go to every single annual preventative care visit? But I don't let my pap smear expire. Number 3, I would not accept if it was painful to have anything enter my body. A partner, a toy, a tampon. Whether it's a pain that you've had your entire life or it's a new pain, I would not accept that this is just normal. There can be a lot of anatomical and physiologic reasons for this pain, so you really should see an OBGYN and a pelvic floor physical therapist to help figure out what's going on and figure out ways to solve it. Number 4, I would not ignore if my periods started to become irregular or way different than they used to be. If at baseline your periods are not coming every 20-ish days, you should talk to someone about that because there's many reasons why this could be happening. The most common being PCOS, which 15% of people with ovaries have. If you start having really weird new periods, I also would not ignore that. The biggest thing in my brain I want to rule out is cancer, but there are a lot of other things that can cause irregular periods, and I want to make sure that's not happening either. And number 5, I would not take a prenatal vitamin right before starting to conceive and in the first part of my pregnancy. And as a girl who threw up her entire pregnancies, I get it. I could not swallow them either. I chose to take the gummies with folic acid instead, but I made certain that I took them the month before I started to conceive and in the first trimester. Did I forget to take them sometimes later on in my pregnancies? Yes, but I always took them in the first part of my pregnancies.